Senate has passed a bill sponsored by State Senator Nellie Poe extending COVID telemedicine by 90 days. This as virtual healthcare becomes mainstream across the country post-pandemic, making in-person visits at the doctor's offices dangerous for both patients and clinicians. So can video visits be trusted to offer the same quality of care as traditional in-person visits? We spoke to a physician who sheds light on this issue.
Doctor, thank you for joining us today. How accurate is telemedicine when it comes to clinical diagnosis and outcomes?
Yeah, I think that's a very good question. Telemedicine has been very useful in diagnosing conditions. The more data points that we have, of course, we could make a more accurate diagnosis, and that could easily be done during telemedicine visits as well. Of course, history taking is the most important part of having a visit, but also some of the other things such as blood pressure, having pulse rates, oxygen levels can be very helpful as well. And it does translate to having better diagnosis through telemedicine. But also, I think the most important thing is having that personal touch and having that personal conversation with the doctor and getting timely visits with the doctor.
Now, what kinds of conditions can patients use telemedicine for?
Yeah, there could be a very wide application of telemedicine visits. It could span from anything as simple as upper respiratory infections, UTIs. It could also encompass chronic care management, such as hypertension and diabetes as well. In this COVID era, there's been a lot of use of telemedicine feature and visits. Mainly because a lot of people are bound home and they're looking to connect with a physician, and telemedicine has enabled us to do that.
Let's talk about the level of preparedness that goes into these visits. Can you share some advice on how patients should prepare for a telemedicine call with your doctor?
Just having a smartphone or a laptop would do. Our staff would go through various steps to ensure that the connection will be very timely. And once they go through the steps, which is a couple different steps, click of a button once a text message is sent, they just click on that button and patient's connected with the doctor.
Great. And, we have progressed to a place where the country is safely reopening. Where do you see telemedicine in the future? Where do you see it going?
I do see continued use of telemedicine in different ways. For example, I had a elderly patient who had COVID-19 along with her spouse, and I had a continued follow-through as she had the diagnosis. And unfortunately, her husband passed away during some of these visits. And I was taking care of her physically and also with COVID-19 diagnosis. But at the same time, I realized also treating her for depression and anxiety at the same time. So I do see continued use of telemedicine visits down the road in the future as well. And I think with even a post-COVID-19 era, I think it will definitely have continued application within healthcare.
And just really quick, doctor, how are insurance companies treating telemedicine? Are insurance companies covering the cost of this?
So far, they have been covering the cost very, very nicely. A lot of the insurance companies have made exceptions during this period of COVID-19 crisis to cover the cost very nicely. So we haven't had a lot of patients have issues with coverage with telemedicine visits.
Great, doctor, we're going to leave it there. Thank you for joining us.
Thank you very much.